Good morning, everyone, and welcome to
I
another.
can't hear anything. Can you hear me?
Yes, we can hear you.
I can't hear you.
Michael, can you hear?
I can hear you.
Yeah, that's good. So let's Gopal to join.
Okay. Can you hear me?
I can hear you, Mike.
Okay, good.
Yeah, I think I'm on now. Can you guys hear me now?
Yes.
Okay. Go ahead, Vikram.
Good morning, everyone, and welcome to another Health AI Institute roundtable discussion focused today on transforming healthcare with AI, roadmaps, benchmark, and patient-centric care. We are thrilled to have Michael Wright with us to share his insights with the session moderated by Gopal Khanna. Gopal is co-founder and chairman of the Health AI Institute. He has held senior executive position in the industry, launched and advised startup ventures, and is a distinguished public servant. Mr. Khanna was a member of Minnesota Governor Tim Pawlenty's cabinet and has led senior executive and foreign service policy positions in the federal government, where he served in the administration of the President George W. Bush and President Donald J. Trump. Most recently, Mr. Khanna was the fifth director of Agency for Healthcare Research and Quality at HSS in the Washington, D.C. As a CXO advisor and board member, Gopal works in public and private sector at the intersection of healthcare, technology, and government. Hand over to Gopal.
Thank you, Vikram. We are indeed pleased to have here this morning with us Mr. Michael Wright. He's a dear friend, a leader in the industry. He has done some remarkable work in terms of transforming companies. You already have seen his extensive bio, which is indeed very impressive. Michael brings a unique background, having turned around companies, having built companies, having taken them public, having been in the private sector, startup ventures, and done extensive work to help companies position themselves for the future. He talks extensively about looking beyond the horizon. He talks about exponential growth, how technology can be used to redefine a company and reposition literally an industry for the future. The industry is changing remarkably over the last couple of years, thanks to the infusion of artificial intelligence and the era of fifth industrial revolution, which is right here before us. So today we thought we'll have a person like Michael Wright to join us and educate us as to how we can take advantage and learn from the lessons in transforming other industries by leveraging technology and how it can be done in the healthcare sector. As we are all aware, healthcare sector is highly fragmented, there's lack of interconnectedness, and therefore patients are suffering. They're not getting the kind of coverage they really need, the kind of service they need. So we are really pleased to have here with us Michael Wright. Michael will do a presentation. Following the presentation, he's agreed to be around for some Q&A, and please do not wait to write and ask your questions. Please drop a note so that my colleague Ikram Khan can collect them. And during the Q&A, we will have Michael's insights further. Michael has also agreed to allow us to post his presentation as well. So you'll be able to delve deeper, and if you have questions subsequently, do post them so that we can have Michael address them as well. And without further ado, Michael, here is the platform for you. Michael, we can't hear you.
Yeah. There we go. Can you hear me now?
Yes, indeed.
All right. Well, it's a pleasure to be here. Thank you for the kind words, Gopal. And it is a pleasure to be here and try and bring some insights. A lot of the things that you're going to see, some of you are going to be familiar with, some of you have never heard before. So bear with me as I kind of go into possibly a little too much detail on some areas and probably not enough on others. So I'll start by sharing what I've got here. Hopefully everything comes up and runs. And we'll get that going. I hope everyone can see this. I can't see you. But what we're going to do today is good. What we're going to do today is we're going to look at what other industries have done, and specifically the semiconductor industry, where I spent many, many years, in how to develop programs and roadmaps and things that can cut across entire industries and actually transform them. One of the interesting things is Einstein noted that you can't solve problems by using the same kind of thinking that were used to create them. And if we look at AI and its potential and all the different imaginations we can bring to it, we can probably come up with some solutions that are not only novel, but unique, expandable, and scalable. So the expectations for today are, we're going to take a look at some technology drivers, some convergences that are happening, and what happens when those things converge. We're going to look at healthcare performance and how we might accelerate that through things like total quality management, cost modeling, and benchmarking. And that's just three. There's multiple others that are out there in other industries. And then we're going to look at symbiotic decision intelligence, which is sort of a modification around AI, where we actually bring in the human interplay, and we'll give you some rationale for that. Some AI recommendations. We've actually run it through a fairly extensive AI program to look at what AI might recommend for healthcare, and then possibly how we might work together to build an AI healthcare roadmap. And with that, we'll get started. A little bias, my background, multiple or what you might call ubiquitous industries. So with filtration software, all that sort of thing. Biomimetics is sort of a new one I'm involved in. But all of these cut across multiple other applications and segments. So I've been privileged to see how different technologies and different products and different processes are used in multiple industries, and I've been able to do that in startups all the way to large cap companies in the billions of dollars publicly traded. So I spent years understanding and perfecting the lenses. How do you look at something, the languages that are employed, and the processes that can successfully intercept what Moore's law is, which is exponential change, because you had to survive. Each one of those dots is a node. It's a size node. It's how small the line gets. Technologies have to be built in order to make those nodes. And oftentimes when you start in the path, you realize you're not going to make the node unless you invent certain things. That I give you tons of stories around technologies that came about just because it was on the roadmap and we had to hit the node. What you're witnessing today and what you're feeling today is the mirror image or the result of Moore's law, because as you come down in transistor size, you increase its speed and its processing density. In other words, it can do more computations and more calculations per second. So if we look at ChatGPT around 2019, 2020, and we look at NVIDIA here this last year, you can see we're starting to go up the exponential side of this curve, which means we're going to see exponential progress in computing power and therefore the things that we can do with it, like AI. This is courtesy of Frank Deanna of Tata, who came up with sort of the original constructs of this, looking at if you have various technologies and you begin to intermingle them as terms of the size of the platform, and then you put them in with how things change in our social environment and our cultural environments. So you see the deflationary force of technology, ineffective economic metrics, declining global growth, a cashless society. If you look at that, it creates new ecosystems, full decentralization, which a lot of people in the crypto world would like. You have adoptions and disruptions, or what that middle core looks like. Those are the things that people do. And then you have the convergences of technology, which are the underpinnings, the big waves, the Internet of Things, IoT, cognizant drones, augmented reality, genomics, coming together with the cloud and big data, and narrow AI, which is an inflection point. And so when we talk about inflection points, we like to measure them. And measuring them is an interesting way to find where we might see an inflection point. So we have different vectors that line up. If you want to look at something like how would you disrupt the transportation industry? Well, one way you might do that in terms of freight is you might do 3D printers on board of autonomous vehicles. Well, then the question becomes, when will that happen, or when might it happen? We did a little research of that for one of the largest logistics companies in the world, if not the country for sure, and said, they asked us what would disrupt them, and we said, well, this might, 3D printing and autonomous vehicles. And they said, oh, that'll never happen. It's too long. People are fooling around with autonomous vehicles. That'll take a while. Well, we turned around and we looked at a bunch of different things and found that there were already autonomous trucks in operation. There were already 3D printers in operation. Then we looked at the patent cycle and found that a number of people, Stratasys locally, but people like Amazon and UPS and Federal Express had already begun to anticipate this type of convergence. So then it's a question of when do those vectors align, and then you pick sort of a window of time that it might happen. An example of that is Nokia in 1996 figured out that the cell phone, now the smartphone, would be the remote control for life. But a lot of the vectors weren't there. A lot of the activity wasn't there that was needed to move it to an inflection point. In 2003, Samsung tried, but some of the other things weren't ready. Batteries, radios, the glass. What really took it over the edge was applications. And once applications were there, along with the radios and the glass and configurations, then you got Apple. So when we look at how do you find those inflection points and how do you accelerate them, how do you accelerate those vectors to make something happen, there's a few industry practices that we at least discovered, or at least I think, would be helpful in the healthcare industry to developing healthier humans as an end goal. Total quality management is one, cost modeling and capacity planning, and zero defects and benchmarking. So we're going to walk through those. But first of all, you have to understand there's a complex interrelatedness of technologies. So this is, I apologize, unless you have a big screen, it's probably an eye test chart. But if you look at semiconductors and what they feed, and you look at flat panel displays and solar voltaics and solid state lighting, they have some common underpinnings, technologies in common: metallization, CVD, chemical vapor deposition. At the bottom of it all is material science and coatings. But these are how these convergences happen to build products that then build other products and applications. So as they converge, and when they converge, you get progress in all these end markets. So that's an important piece to understand as we look at how we bring things together in the healthcare industry. And part of that is having quality programs that are effective. And by effective, that means that everybody is involved. And total quality management started a long time ago. The original idea was actually in 1961, total quality control. And I think it's Feigenbaum is how to pronounce that. But it emphasizes continuous improvement, always moving towards better, better, better. Now, one of the interesting things that you run into in technology, and we run into in science as well, is that you can take something up to a point and then you can't take it further. And that point is where the physics runs up against economics. You can't get more out of it. It is possible, however, to get to zero and to get to sigma levels of perfection. And part of that was done by Demings and others, and it did it with the Toyota production system. And I will stop for a moment to say a little bit about zero defects. If you don't set zero as your goal, you'll never get close to it. You'll always accept something in between. So the industry that I came from, semiconductors and semiconductor equipment, always had zero at its goal because we knew if we set it any different, we would never get close and we would never improve at the rate we did. So this is one area to look at, TQM, and the important thing is to get everybody involved. So we took TQM and so we said, well, what are the key principles of TQM that might be applicable in healthcare? Well, first of all, you have to focus on prioritizing the patient needs and expectations. What is it that the patient needs and what are their expectations around delivering high quality care? Because at the end of the day, they're the ones that judge it and matter, and it matters too. Continuous improvement, regularly assessing and enhancing healthcare processes. Look at their effectiveness and their efficiency. Constantly reviewing, are we getting what we expected out of this particular process or procedure? Are there ways to improve it? What are the improvement paths? And then getting employee involvement. Now, I can give you a personal story around employee involvement and how important this is to quality and what you can do with it. When I was at General Signal, I had a responsibility for part of an operation called lithography. At GCA, we invented the stepper, the lithography tool. And when we started to employ TQM, which a lot of it came out of some work we did at DARPA Semitech to come up with total quality management approaches, we trained everybody on scatter charts and all kinds of different techniques and measurements and metrics and how to improve quality. And we taught them all, and nothing happened. And then we finally figured out that the best way to teach was to have a program and a project in place that people involved in that particular process or activity could get involved in. And so real quickly, what we did was we had environmental chambers that we had to make. These are air purification systems that wall off the lithography tools, because when you get down into submicron range, you have to have very pure conditions in the environment. And they have to be controlled very well. And it was taking us anywhere from 6 to 9 weeks to build this environmental chamber. We figured out that people were walking nearly 7 miles between getting products or getting parts, putting the parts on, and actually building the environment. We then turned it to them and said, okay, you tell us what you need. Now, I'm responsible for this area at this time. I ran all of product development and marketing and all that good stuff. But they came to us and they had a requisition. And then the requisition was a saddle. And you're going, what in the world are they going to use a saddle for? But being true to form in the company I was with, we supported and enabled people, and we got them a saddle. Well, they put it to good use, because that same team, by relocating the cages where they had to walk to get parts around the environmental chamber they were building, by putting the saddle on a mechanic's rollerboard, they could sit on it and be at eye level where most of the work was, and they could roll around the environmental chamber to put everything together. They went from 6 to 9 weeks to 2 weeks and didn't walk more than 10 paces. So that's just an example of what happens when you involve the employees. Understanding and optimizing healthcare processes, integrating the systems. I think that's a big one because of all the legacy systems that I think the industry faces. Data-driven decisions, utilizing accurate data, which most of you are very familiar with, and communication. This we found to be the most important thing. Where are we? What's happening? Are we making improvements? How are we making the improvements? Do we track it? Do we monitor it? And do we talk about it? So again, we could look at clinical pathways, developing standards, standardized care plans. I'm sure that varies from location to location, from doctor to doctor, from treatment to treatment, although there are some basic standards. Is there a best standard? Getting the feedback from the patients, not just what happened to them and documenting the sort of activity, but what did they say, how did they feel, what was going on, how did they leave the treatment or the process. And then staff training, ongoing education, training healthcare professionals to maintain the high standards. How do you get to a higher level? And again, a lot of this I think you're already doing, but maybe not to the degree that's done in other industries. And then performance metrics, what are the key performance indicators? And actually monitoring these and evaluating them against what the care is. Sometimes you can have the wrong metrics. Other times people don't pay attention, or you don't communicate them to tell people how they're doing. So now we're going to take an abrupt change to cost modeling. This is one that's sort of near and dear. And how does the healthcare industry look at costs? Who all's involved, and do they have a common way of measuring it? Well, I was fortunate to be at the center of this particular activity. We formed a company after I left General Signal called Wright, Williams & Kelly, wwk.com. We were fairly early. That website was up in 1992, and I'm aging myself real quickly here. But we considered how we were going to be able to take what we knew from Semitech, which was what we knew about the Japanese at that point in time, was how they were making a chip. Because every chip has a signature, you can tell layer by layer what type of equipment. You can even trace it down to the particular brand of equipment and know what was used. So we knew how they were building it. What we didn't know was cost. And so after a lot of work and research and development, we came up with cost models and cost of ownership. And once that got adopted by the entire industry, it became a way of comparing everything in the industry to a common standard of cost. And then looking at the variances and what we could do to improve cost and improve cost of performance by tool, by process. And then it was incorporated into something called the ITRS, the International Technology Roadmap for Semiconductors, which drove the industry for decades, and we'll touch on that some more in a little bit. So one of the things that you can do with cost of ownership modeling is you can look at how things are doing in real time, and you can also look at them over the lifetime of the process. And this becomes very important when you're considering what things cost. And so purchasing people, a lot of time it's, well, this one was $10 and that one was $11. We're going with the $10. But if you don't look at how it's being used and what happens over time and how it affects the outcome of that particular process step, you'll never know what your true costs are. And the industry needed to know that because of making millions and millions of things and actually being in a competitive position. One of the areas was what we called environmental safety and health. You could translate that today to some of the ES&G activities going on. But we needed to know, well, how does this tool compare to a different tool when we look at the impact on comparing ESNH alternatives. And I'll give you another real life example. I'm sure many of you have heard the company called TSMC. TSMC is on an island in Taiwan, and they had a choice of processes. One process was liquid. It's cheap, liquid chemicals to do etch. And in doing liquid chemicals to do etch, you're basically throwing a bucket of chemicals over a wafer and it etches it. And then you catch the liquid and actually, contain it and take care of it. The other side of that was to use a dry process, which is expensive. However, the mass balance equations would tell you lost very little of the dry powder in the process. So on the one hand, you have a very expensive initial process. On the other hand, you have a very cheap process. However, when you look at them over time, you begin to see something different. And time in this case isn't just 1 or 2 years of operating the fab or even 4 or 5 years. It's the lifetime of the process. Many of these fabs operate for 25, 30 years. A couple of them are actually operating longer. And in that longer time horizon, when you look at it and you compare the dry versus the wet, I mean, you end up seeing what happens over time. You have to capture the liquid because it's a contaminant, it's toxic. You have to put it in a barrel. You have to transport the barrel. You have to bury the barrel. You have to monitor that burial site for leakage. You have to insure it, and you have to take out some sort of liability reserve against it. When you do that, the lifetime of the process starts to give you a different answer in cost. So it's very important when you're looking at costs in healthcare, how long are we going to have this equipment or process, and is it going to perform over time? And what are the externalities and long-term pieces that you have to look at? And is there or can there be losses due to the damage that occurs either to the patient or the facility or the piece of equipment? So here's an example of developing, and what we mean by digging deep and looking at things very, very closely, again, in a high technology industry, which I would treat healthcare largely as a high technology industry, or at least it's beginning to approach that. In this case, we were looking at a particular furnace or type of equipment. It cost $1.3 million. But then when you start to break down all of the different activities that are involved with operating that piece of equipment, with owning that piece of equipment, and start to look at what it actually does over time, you begin to look at and see the cost per actual process and what that ends up giving you. So hang on 1 second here, my computer's doing a bit. Okay, so if you look at depreciation, everybody has that. Maintenance, floor space. These are typical things that the accounting people capture. But did you capture the training? Did you capture the system qualification cost, actually installing it, running it up, bringing it up? How many times did you move it and rearrange it? If you have permitting and other things. So when you're processing large amounts of something, small numbers really count. When you look at how many other things are happening around a particular process, and we look at materials, consumables, labor, depreciation, you can Pareto those and say, well, there's an opportunity here if we could lower the materials, the consumables, to actually reduce our costs and perhaps improve our performance. Some of those costs or materials, consumables can be waste. Why are they wasted? Well, the machine doesn't work as well as it should, or the process doesn't happen, or the people involved aren't trained well enough, so they end up making a lot of mistakes, et cetera. And you can find those by seeing what happens in the costs. There's also some things that can fool you. You say, well, this one's cheaper. Yes, but how many wafers or how many patients, if you will, are you putting through or utilizing across that piece of equipment? And so what happens is you have to look at how they respond at different loading levels and how many units or how many pieces of equipment you might need in order to maintain that throughput. Do you need 3 CT scanners, 4 MRIs, 6 X-ray machines. Well, if you're buying that level and kind of equipment to us, equip a hospital, one thing you might ask is how many patients do you expect to see in that facility, and then go back and do your comparisons. And what you end up seeing and what we found was, well, it depends on where you run your factory as to what piece of equipment you might want to purchase. So in this case, if you're running very low volumes on a monthly basis, you're probably pretty good with, equipment set one. However, if you start to get up into higher volumes, you're definitely better off with equipment set two. Well, then you start to say, well, if we look at the entire process, now you could break this down to a unit, something that happens in ER, something that happens in a particular surgery type, any of the things where you have multiple steps. But if you take it apart step by step by step by step by step, and you look at the cost associated with every single step, you begin to get a picture of what the actual entire process costs you in order to get that particular outcome. And it includes things like how far people travel. How long it takes from point A to point B. If you have to send out for lab work, how long does that delay take? What does that cost while everybody's standing around? All that sort of thing you begin to see, and you get your cost. Maybe you move that particular test from the lab to inside the operating room. So here's an example of an older type of process, but just to give you an idea of how far it breaks down and why in the semiconductor industry it's so important, we start with step one, and we end up with all the way to step 210, which is the visual inspection that's needed before you can actually release the wafer. And it gives us the unit cost per process step, and then it gives us a total cost per wafer or per patient. So the question I would have to the healthcare industry, I dare, is when processing a patient, how many steps? How many times is it touched by a machine, a human, or waiting? And I should say, is that person, not it, touched by a machine or a human or waiting? How many steps are involved? Are those steps ever optimized? Have they been optimized? An example of that is we built something called cluster tools in the semiconductor industry, which said, well, we have process A that's followed by process B that's followed by process C every single time. Why are we moving the wafer from this bay over to this bay and then doing that step and then moving it to another bay and doing that step? These are very common. They have very common support requirements. For example, vacuum or pressurization or electrical, whatever. You put them together and now the wafer is the only thing that moves and it stays right there with the piece of equipment. What if we did that with patients? That's optimization. Optimization in that case for throughput. Is it optimized for cost? Sometimes you can find a different way to do something that is less expensive, more practical, and cost less. Just because it costs more doesn't necessarily mean it performs better. And then are we doing and optimizing for quality? Not just the quality of the outcome with the patient, but the quality of every step in the process, back to that TQM, where we actually look at, is that a high quality way to do that? Do we get the performance that we want to get? And I don't know, I'm not in the healthcare industry. I've been a customer. Are the metrics for the healthcare industry correlated to the measurements for something like lifetime wellness? Suppose that was your metric. Instead of good wafers out, we look at the lifetime wellness of the patient. We take into account all the many factors, social determinants, other pieces that might come into play that gets us a yield number. And yield number says, wow, we put in so many patients through our industry. We got X number out that rated at this level. And that rating could be what other metrics would work besides just lifetime wellness. And that's your industry to decide, although we'd be happy to help with maybe finding what some of those are. When you get there, when you treat a patient, their lifetime wellness, if that was treated the same as a good wafer out, you would be able to start to look at larger scale activities. Now, this was done a long time ago. I don't know whether it expresses the gap that might be in your industry, but I can tell you that many people in the industry I worked in, and this is from CH2M Hill that actually bought WWK, we started to look at cost models for the entire enterprise for what happens when we put everything together. We use, a good solid database, which I think you have several of. They're probably not integrated enough to be able to use in this way, but we could start with the number of wafers that we wanted to process. Here you could say number of patients, and we could break it down step by step and build a cost model for every step along there, integrate them at the end, tie that back to activity-based costing against the factory cost model, and actually get back of the envelope speed with rocket science accuracy. Meaning we were trying to get to a point before we put a shovel in the ground to build a factory, we could look and get very close to the cost of processing each wafer. That gave us a target of what the ROI might be. I'm not saying that we need an ROI with patients, although the economy always gets an ROI if there's more healthy people in the workforce. So how would we measure it? What could we build? And could we do it in a way that we could do it fast enough and accurate enough to make a difference? And sort of what got me thinking was we, the healthcare industry, handle and process millions of patients each year. And so my question to you is, how do you measure yield? What is it that's the outcome that you want that you can go backwards and improve every step along the way, both for cost, for quality, and for the metrics that you use to find that lifetime wellness? So once you do that, once you establish those, you can begin to measure, you can begin to manage, you can achieve all kinds of levels of quality, and you can improve the overall enterprises, hospital, HOA, whatever it is, operation. Well, once you improve it, where do you look to find ways to improve it quickly? And there's something called benchmarking. And a lot of people think that's looking at your competitor. It's not. We're looking at something similar. UPS and FedEx, they're considered to be, very good at doing something. We'll bring that in a second as to what they're good at and how you might look at this. But if you're building a distribution center and you want to know how to build that distribution center, what's the latest and greatest practices that are used, the question I would have for you is, where would you look? And a lot of people say, well, we'd look at other distribution centers. Okay, there's, somebody down the road, a commercial factory possibly, or maybe a grocery store. But the real people that you would look at is somebody like UPS for distribution. And you'd look at them first. You'd look at UPS, you'd look at Federal Express, you'd look at others to build your distribution channel before you'd start looking at somebody else's distributor methodology to get the best of breed. So that's benchmarking. You want to identify performance measures. What are you looking for? What are the partners? Who are the people you could go and talk to about it? Then you could determine how you're going to collect the data, measure yourself against that data, then go measure your partners, take a look at the gap, figure out where you want to go, communicate those results, come up with some goals, implement and monitor the progress, and recalibrate, and do it over and over again as you look at various other people that are doing that process better than anyone else. So as I said before, what it's not competitive intelligence. That's just looking at what the other people are doing. How are they operating their MRI machine? Which one did they buy? How many are they using? That's competitive intelligence. That's not benchmarking. Competitive intelligence focuses on a broad range of competitor activities, not just that, and comparing the best practices and performance, which can be found inside or outside the industry. And I'll give you an example of that in a moment. But first of all, people always say, well, where's the value? I don't care what they're doing. We do what we just do what we do best. That's not necessarily the best way to go at it. You need to find the best known methods that are out there, then meet or exceed the customer requirements. If you know the best methods that are out there, you should be able to get to that second one. Gather the data, get realistic goals, know what is possible, and then set the goals to achieve that. You can gain a competitive advantage in the marketplace by doing that, and that's extremely important, obviously, in highly competitive industries like the chip business. But it also gives you something else that when you have boards that don't want to approve different expenditures or they don't think it can be done, you go out and look at somebody else that's doing it, And you bring back the power of the possible and say, well, if they can, we can. Unless you run up against that physics challenge. But in the 1930s, lots of studies said that there was no way the human body could do the 4-minute mile. Then somebody broke it, and within the next year, 7 people ran faster than 4 minutes. So once it's demonstrated that can be done, it sets the bar and people go after it and they can achieve it. What that means is the first dividend that you have is converting disbelievers into supporters, meaning you're able to convince that board to get behind you, release the funds, and get after it. But it's also a step towards strategic leadership, because you know from a leadership position, once you put that in place, you're able to achieve those goals, you're going to have a leadership position. Other things that it does, it drives your planning process for legitimate goals because you can show that it's been done. You're not guessing, you're not saying, well, we can't do it here, we've never done it before, the classic, or we've always done it this way, which is the death of most programs, doing it the way we've always done it. But if you can go out and you can show that other people have done something that is against the same metrics. Remember, we said, look at the planning pieces where what are you going to measure and then how are you going to determine it? And then do that to your own operation. You can say, well, they did it. It's the same metrics. We should be able to do it. Decisions are based on data, not on assumptions. Assumptions are the thing that undermine and kill or destroy most strategies. You didn't get the assumptions right. And customer requirements are the major focus. In this case, defining who the customer is, and that's not always the patient. That might be the next people in line, might be the lab wanting their specimens prepared a certain way. Other activities where the handoff is internal, not external, and that's your internal customer. So here's the relative position of benchmarking and information. This is from Intel very early on. This goes back a long ways because they've been at it a long time. And this is how they looked at you as a supplier. So if you were supplying Intel and you only got up to, well, you're kind of looking at different things and you've looked at surveys and you've done some market analysis and you've read business articles and you've looked at your internal capabilities and you've done a bunch of things. They looked at you as a lagger. Okay? You weren't ready to play with them. If you looked at survivors, how they categorize survivors, they looked at competitive analysis, they ballparked, they looked at industry visits, they talked to people, they did partnerships, they did customer competitive analysis, and it made some increasing in, of the power of the possible. But then it's survivor skills, which is business intelligence, which is a whole nother level of thinking. But at the very top was benchmarking. Being able to set realistic goals as a supplier and achieve them was very important to Intel when they started to look at you as a supplier. So it's also, when you use benchmarking, a shortcut to leadership. You can be best in class and get there quicker by doing that. And I see I'm running tight on time, so this is good. I've got a few minutes to get to AI and healthcare. So I just wanted to give you that sort of backdrop of looking at 3 different ways of improving processes within the healthcare industry by adopting other methodologies that have had literally decades to improve themselves and become very easy to apply. Easy in the sense that we know what to do. The hard part is getting people to go along with you to do it. So part of this, it says, well, in AI, what are we going to do with it? And this is, I'm sure, familiar to most of you. This is Lewis and Carroll and Alice in Wonderland. And she says to the cat, would you tell me, please, which way I ought to go from here? And many of us that are in the healthcare industry or in the AI space are really looking to AI to try and find where ought we to go from here in our particular arena. And it went a little bit further. If you really go through the whole quote, she says, that depends a good deal on where you want to go. So we have to lay out some goals and some metrics. Alice, unfortunately, says, I don't care where. Well, those aren't important because they're all specific to this, that, or the other thing. Well, yes, they are, but you need to integrate them. Then it doesn't matter which way you go, said the cat, so long as I get somewhere, said Alice. And she said, well, I'm sure you can do that. You only have to walk long enough. And I think part of where we waste a lot of time and energy in this space is walking around and not knowing where to go. So we have to go on a path of discovery, and that's really thinking about things like nobody else has, even though we see the same things, which is sort of the first slide in this presentation. So here's some examples how human intelligence and AI are here now, and many of you in the healthcare industry are aware of diagnostics and what's being done there and how fast that's moving. In the financial world, it's forecasting market trends, and in scientific research, we have things like Fold 3. AI is very powerful, and it can do some very interesting things with visualization. These visualizations capture the mathematical network of protein interactions and sort of looks at many different things, where they cluster, where the edges are, how they interact. But it gives you both a spatial relationship, and it can give you a time relationship of how these interactions occur and take place. And that's extremely powerful, obviously, in research. One of the challenges that we have in using AI is it isn't decided yet how we bring them together and what we're going to do. Some people want to make the machine, which is a disembodied intelligence, like the human, which is an embodied intelligence. That's not going to really work very well, even though we are beginning to get better at giving disembodied intelligence sensor capability. It doesn't mean it's going to get there in a way that truly gives us the best opportunity for insight. And so we started to look at something called symbiosis in nature, obviously, and how we interact or make those two interact to the benefit of both agents, because they both really have agency if they're not under constraints. So we said human brilliance, wisdom, and experience with artificial intelligence can lead us to something called symbiotic decision intelligence, where we actually use the best of both worlds, do an orchestrated iteration against a topic and find out what might be around the corner, what options and insights might develop, and then try to give management more time to make better decisions by having more information and more knowledge about the future. So we didn't do it just sort of haphazardly. We involved ourselves with partners. I've been involved with deep dives since probably 2003. It came out of the Human Genome Project, and they figured they had a very powerful search engine. You can drop a page into it and it'll actually search for it. But what it does is it just looks at the relationships that are out there and searches the journals that many people use and that aren't available to the public in general. Incubig looks at the USPTO, some people that came out of MIT and IIT. Shaping Tomorrow has been around for about 22 years, was one of the first people to use AI and machine learning to go out and look at forecasts. They looked at 80 to 100,000 journals a day and scraped them, and they've gotten better and better at it over the years. Preempt.life was developed by the people that came up with Shaping
Michael,
Tomorrow.
We have 5 more minutes, and
okay,
we have to wrap the presentation in the 2 minutes, and then we'll be having conclusion summary.
All right. So anyway, looking at all of these capabilities and platforms, they begin to give you a picture of what's happening in the healthcare industry. And it brings up all the different things that you're aware of: smart tattoos, lab on a chip, but it can also give you many, many more: AI-driven drug discovery, et cetera, and maybe some things you haven't thought of. Preempt.life I've been involved with for a long time. We have over 1,000 foresight tools that we put on to ChatGPT. Our average runtime on a project is about 4 hours. So that gives you an idea of how many activities we're going through. We break it down into strategy, reasonings, findings, insights, et cetera. Once we put that together with something called InfoNotice, we take that huge report, run a scan on it, do some various things to it, and we start to find out the relationships. We then figure out where the most important ones are. We then break that down into recommendations and come up with a strategic roadmap. They get very detailed, from executive summary to current state of healthcare, core implementation areas, et cetera. And then we go back and say, well, where should we look and what are the big issues? And so you have things like fragmentation, which we know about, but clinician reluctance is called fear, uncertainty, and doubt, not knowing where we're going and what needs to be done. And then I'm going to not go through these because of the interest of time, but they'll be there. But essentially looking at SDI to give us what are the mid to long-term healthcare vision goals, how would you address them, data security, addressing disparities, what might be the process that you use to go over the next 5 to 10 years, what has to be accomplished, is laid out. Resource requirements and the technologies that need to be used. What research has to be integrated over time in order to get there. What risks have to be mitigated. And then how would you measure the metrics of success? Again, these become very important to define, I think, as a healthcare industry, especially if you're going to use AI. And then what the priorities are and a vision. And where I want to get to here, and I apologize having to go so fast at the end, but there are opportunities. And this is, I think, more for you as an institute. The way members in an organization communicate and collaborate actually shapes the output and the character of what you produce. So I said, what if the healthcare industry could collaborate on a roadmap for the development and deployment and adoption of AI? And what I used was the ITRS, the semiconductor roadmap that was used for decades that literally everybody signed up to. That's what made it happen. And as Einstein said, make it as simple as possible, not simpler. Here is what an augmented AI healthcare roadmap could look like on a 7-year window. These elements down the left side are actually the ITRS challenges or the categories that we put every single process into as we went from node to node. This has been redone for healthcare. And I would say it's fairly accurate and pretty good. If we look at it and break those out, if we tried to do it in 7 years, these are the things that we'd have to accomplish. The stoplight chart just says, hey, this is a very high priority. You don't have what you need. You need to be working on it in order to get there in that time frame. Here it is if we took it out over a 20-year period and what that might look like.
Michael, we are running out of time. May I?
Okay, here we go.
Take it from here. Thank you so very much, Michael, for being here with us today. To the audience here in the States and Minnesota, what I would like to say is there are 3 things that are happening right now that we need to be aware of. The Health AI Institute seeks to provide a platform at the intersection of healthcare, AI, and government policies. With the change in administration and with the new administration coming in, the challenge that we have to deal with is, number one, the cost factor. There's an enormous amount of cost cutting that is required to really meet the challenges of our nation's budget. 17% of the GDP is spent on healthcare. It's not sustainable. It's on a path where something needs to be done. The second factor is that the president-elect is focusing on healthy America. So there has to be emphasis on 0 defects or no harm in the healthcare sector that we talk about. And finally, the third thing that is being looked at is the ultimate value that is being created in the sector by all the verticals coming together horizontally, not just vertically. Having said all that, I think there's a lot to pack further and there's a lot of questions. Michael, we will put your presentation up and we will call you back again. And by the way, to the audience, I will say, please send in your questions. We'll come back to Michael and ask him to give us answers because really there's a lot to do. To the industry, I will say, with the infusion of new technology, new paradigm, new challenges, we just need to think differently from board, CEO, CFO, all the way down to those who are responsible for technology management in enterprises across the entire ecosystem. With that, I will say thank you for joining us, and we will have another roundtable discussion coming up soon, and you'll hear about it. Thank you, Michael, and thank you, Ikram.
Thank you.
Thank you, everyone.